In the name of God, the most gracious, the most merciful, peace and blessings be upon you. This is Najm El-Yusuf, your instructor in anatomy. Throughout this educational series, we will explain and cover the subject of anatomy for sports science students at the College of Sports Sciences. To begin, we must recognize that anatomy is an extremely important and foundational subject, taught across universities and educational institutions in various fields, including medicine, occupational and physical therapy, histology and cell biology, and our own field of sports education. Anyone wishing to enter or specialize in these fields must develop a thorough and solid understanding of anatomy. This course will focus specifically on the field of sports education and related disciplines involving movement, the human body, muscles, rehabilitation, and therapy. Students must understand this material deeply and know how to study it effectively, as it will serve as the foundation for future courses such as sports injuries, physiology, kinesiology, biomechanics, and histology. The importance of anatomy in sports. First, understanding body composition and organ function. Students learn about muscles, bones, joints, ligaments, organs, their locations, and their range of motion. They also gain the ability to identify their own physical strengths and weaknesses and work to improve them. Second, selecting appropriate sports. A coach with a strong grounding in anatomy can match athletes to the right sport based on their physical characteristics. For example, selecting shorter, stronger athletes for weightlifting and taller athletes for basketball or volleyball. Third, understanding individual differences. Anatomy enables an understanding of the physical differences between males and females, allowing for the tailoring of exercises, training methods, and sports activities appropriate to each. Fourth, prevention of sports injuries. Knowledge of the body's anatomy allows for the correct and safe execution of exercises and movements, significantly reducing the likelihood of injury. Fifth, treatment of sports injuries. When an injury occurs, knowledge of ligaments, tendons, and muscles enables appropriate management and recovery through rehabilitation. Sixth, maintaining physical health. Anatomy is applied to preserve overall health through the correct and efficient use of the body and the proper performance of physical exercise. The importance of anatomy for the sports coach. When a coach is well versed in the structure of the human body, its muscles, joints, ligaments, and bones, they become capable of developing athletes, designing appropriate training programs, identifying each athlete's strengths and weaknesses, building on the former and addressing the latter, as well as preventing injuries and managing them when they arise. Course contents. The material covers the following. Part 1. Fundamentals of anatomy, including the anatomical position, anatomical terminology, anatomical axes, and types of body movements. Part 2. Anatomy of the human body's systems. The human body comprises approximately 11 systems: the musculoskeletal system, the digestive system, the immune system, the circulatory system, the reproductive system, the respiratory system, the urinary excretory system, the nervous system, the integumentary system, and the lymphatic system. However, sports students in this course are required to study only two systems: the musculoskeletal system, comprising bones, joints, cartilage, ligaments, tendons, and muscles, and the nervous system. This concludes the course introduction. Students are encouraged to review and understand it thoroughly in order to grasp the scope of the material and organize their studies accordingly. See you in the next video, where we will cover the fundamentals of anatomy.